Dr. Dana Medicine Woman coming to you today to talk about breathing. Yay! The respiratory system. So this is so critical and important. I can't tell you how many different disorders I see that I teach these techniques to my patients to each and every day, because as I talk to a lot of patients in my office about, I like to open doors for you to walk through. That means self-healing. That's one of the basic principles of osteopathic medicine, is the body has an innate ability to heal itself. The problem is our bodies don't come with a user's manual. So many patients say, why is that? I know, it's crazy, but I'm gonna try to help you a little bit today to give you a user's manual for breathing. So that's really what this is. I want you to have a foundational understanding though, because if you understand why you're doing what you're doing, you're going to do it more often, you're going to do it better, and you're really going to make this a part of your daily routine, which is what we really need to do to effectualize change in your life. So here is our respiratory system. Of course, we know we start with our trachea, which is what we can see in our throat, and then it goes down into our main stem bronchi, and then our right and our left main stem bronchi, and we have bronchioles and a bronchial tree. Then at the end of that, we have these little things called alveoli. That's where our main air exchange is taking place, which is what in effect means that if you don't deep breathe or get all the way to the end of the lungs, where those alveoli are, you're not really getting good air exchange and air movement or toxin release. So we need to bring the good oxygen in, and we need to release out the carbon dioxide and the other toxins from the lung so that we can heal. The other thing is, I wanted you to notice the lungs are kind of like balloons in a sense. So we are visualizing the expansion of the balloon and the contraction of the balloon as far as the lung goes. The reason why we're going over all the anatomy first is that I want you, as we're doing our exercises today, to have a really strong visual in your mind about what you're doing and why you're doing it. This is a process and a journey of getting to know your body. So I want you to get to know your body well and to be able to interpret the signs, be able to self-heal. So also I wanted to talk to you about the thoracic cage. This is the bony structure in which the lungs, of course, sit in. And you have your ribs, which is what you mainly think of. And they're pretty amazing structures. They go all the way around, very three-dimensional, go around your whole entirety of your body to protect the vital organs of your lungs and your heart. Super awesome. This is in the front, your sternum. A lot of people get restrictions in the sternum. This is a very common problem because we're always hunching forward, looking at devices or doing whatever work that we need to get done. It tends to be a forward hunching or flexion experience. That will cause collapse in all of this area, and that will cause also fascial restrictions around there. You have lots of dense fascia, as well as at these costochondral joints. Some people even end up in the emergency room because they have costochondritis and they think they're having a heart attack. This also has a lot to do with anxiety disorders, because if you're not breathing properly, you literally feel like the life is being squeezed out of you because you're just not getting oxygen to all your tissues. It is 100% necessary. So this is good for so many different kinds of problems. We're talking about problems in dysfunction of the lungs, in dysfunction of the heart, in dysfunction of the endocrine system, the nervous system, and even psychologically, because that's really all tied together. We're all one unit. So mind, body, and spirit. This is the sternum. We talked about the costochondral joints. We talked about the ribs that are arching around. And a lot of people don't think about it, although it makes sense, of course, that the rib cage each rib connects to your thoracic vertebra. So lots of people present with just chronic tension and pain in the thoracic vertebra. And this is a great, amazing technique to help. And really and truly, you will end up just having recurrent pain cycles if you don't learn to breathe properly. So this is really important, and this is why we're doing what we're doing today. Just wanted to show you a couple more educational things before we move on to the active part of what we're doing. But this is a side view of the diaphragm. So you can see how it has this also kind of almost balloon-like structure. So you have these balloons of the lungs sitting inside this cavity, but then you also have this arching type of structure that is fibrous and dense in the outside and muscular, but also spongy in this white area and can absorb toxins, and a lot of times does absorb toxins and create dysfunction in the body. So if we can get all that moving properly, it is amazing the positive effects it will have on your body. So we're gonna come on up here, and we're also gonna be talking as we work on the types of ribs. So we just looked at the thoracic cage, and in that we have three main types of ribs. We have the lower part, which is our caliper ribs. Those are the ribs that are just gonna kind of move in and out like this at the very beginning of the inhale and the very end of the exhale. So that's gonna be the initiation and the final contraction for exhale. Then you have what's called your bucket handle ribs. These are the main parts of the ribs, which you really think of as your ribs, and they go more like a paint bucket where it goes up and down like this if you were to visualize it from the side, okay? So you're gonna also feel a lot of expansion, but because of that, you're gonna feel a lot of what we call internal and external rotation. Most of us are stuck kind of in this internal rotation that goes along with what happens when you're overly flexed. You just kind of just get closed in. So we want to be able to open all that up and expand. So we're going to do a lot of that with our inhaling today with those bucket handle ribs. And then finally you have the pump handle ribs. Those are the ones that come up and down like an old school water pump, okay? And those are the first five, and they kind of go more up and straight up and down the first one, then in descending order kind of angle like this. So you're gonna see me do hand motions too to describe the motion for each part of the breathing that we're doing based on the type of rib that is moving at the time. So that way you can start to get a visual cue and not have to necessarily be hearing my voice, but start to get that visual cue, which is gonna help tie into your body motion. So first we're gonna feel our ribs. So let's just kind of get together with our own self and feel our ribs. This is the lower part of the rib cage. If you feel on down, maybe lower than you even thought. Maybe you thought those were your kidneys, but right down there at the bottom, you can see these are your lower or floating ribs down through here, okay? Those are the ones that are that caliper. You're gonna feel those pushing back and down. So we want to be using mainly our diaphragm for breathing, and then our intercostal muscles. Those are the main muscles of respiration. There are other muscles that can be used, the scalene muscles up here that attach. Also your pectoralis muscles can help. A couple of your back muscles like your quadratus lumborum and your other not necessarily erector spinae, but some of your other spinal muscles can help with respiration, but you really don't want that. You want to be using your diaphragm and your intercostal muscles to expand and contract everything. So we don't want to be necessarily recruiting those muscles in healthy breathing. Some people talk about belly breathing. I don't want to talk about that because I think it creates the wrong image in the mind. People think of the belly, this is your belly. That may move some with breathing, but as we just looked at from the anatomy poster, this is the area that is your diaphragm, okay? So we want to be thinking about this area, not this area. So we want to actually be kind of engaging our core, bringing our belly button in towards our back as we're doing our exercises. And then we're going to be thinking about this three-dimensional expansion and contraction of each of the three parts in our three-part breathing. So let's put our hands down here, and let's just going to feel around a little bit. And let's practice just some basic inhales. So inhale in. Feel those hands moving and expanding out, and then exhale. Feel those hands contracting and coming back in with the rib motion. And you can actually use your hands a little therapeutically. If your ribs are a little stuck, you can kind of pull them as you inhale. And exhale. Gently compress them in as you go back in. Inhale. And exhale. Inhale. And exhale. Awesome. Next, we're going to do those bucket handle ribs. So we're going to come here and we're going to feel how that moves with our inhalation. So inhale, expanding out, exhale, contracting back in. Inhale. Exhale. And as you inhale in, you're going to feel your sternum rise, that front bone, and kind of lift as those costochondral joints expand. So let's inhale and exhale. And this is an area that women commonly have problems with because maybe you've worn a lot of underwear or bras, or you have real heavy breasts. So you can do some therapeutic exercise there to work on moving those ribs. A lot of people will think they even have breast pain, and it's not. It's actually rib pain from rib dysfunctions. So this will kind of help you get in touch with your own body and see what's really going on, maybe even save you a trip to the doctor. So let's do it from the side of those bucket handle ribs. Inhale. Exhale. Inhale. Exhale. One more. Inhale. And exhale. Great. Lastly, we're going to do those pump handle ribs. So I'm going to let you just kind of roll your shoulders back and down a couple of times, kind of get those relaxed backs. We don't want our shoulder blades in the way. And then we're going to have our hands right here, kind of in our trap areas. Feel that. And remember, it's the end of the inhale that you're feeling this motion. So it'll take about 3 seconds. So inhale and exhale. So it initiates the exhale, but it's the end of the inhale. Inhale. And you're going to feel that in the exhale. Inhale. Exhale. Inhale. Exhale. And you may feel motion more on one side than the other. That's just a sign of some dysfunction. So really great that you're doing this, right? Because you're actually working to heal yourself with some self-healing techniques. So that's great. So now we're going to try to tie it all together with our 3-part breathing. So just get into a comfortable seat. You can keep your feet on the floor if you want, but because I like to do yoga, I like to kind of get in a yoga posture. So we're going to start with our hands here, and we're going to go on up with each component of the inhale and then back down with each component of the exhale. So we can time it out and start to get that rhythm. So inhale. Exhale. So I'm going to count it out. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Again, inhale. 1, 2, 3. Exhale. 1, 2, 3. Good. So we're going to start it and we're going to put it all together. And I'm just going to be signaling with my hands as we're breathing for the 1 and the 2 and the 3 and the 1 and the 2 and the 3 in reverse order. Okay, here we go. Inhale. 1, 2, 3. Exhale. 1, 2, 3. And now I'm not going to count. I'm just going to use my hand motion. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Amazing. You are doing such a great job. This is so important. And I think you can probably just feel better. Sometimes people just feel a lighter sensation, just like their nervous system or a fog has lifted off of them when they're doing these exercises, which is exactly what we want. We want physical strength and we want mental clarity, and these breathing exercises can really help you to do this. Now I'm going to finish off today with my favorite therapeutic exercise. I have almost all of my patients in my office do this because it's such an important mind, body, spirit healing tool. It's called deep breathing with arm circles. So what we're doing is we're doing the 3-part breathing, but then we're adding the component of the arm circles. So we're doing a stretch up with inhale, and then a circle back, out, down, and around with the exhale. Okay, so you're also going to get a shoulder freedom rotation. It's going to be really freeing on all those shoulder blade muscles that we all use too much. It is important that your fingers and your hands are also an extension of this exercise. So you're one long line of energy. Oftentimes we have problems with our wrists or our hands, our shoulders, because we're not energetically linking all of our body together. That's something that yoga does a really good job about talking about with the lines of energy. So we're going to utilize that technique in with our therapeutic breathing. Okay, so here, let's get in a comfortable position. I'm going to just stay with my feet on the floor. So since most of you will probably do it more this way, you can also do this technique standing. It's amazing to do it that way as well. So we're going to inhale, stretch up, exhale, back down and around. Inhale up. Really stretch and give it a last little kind of pull stretch at the end of that inhale. Another little sip up to get those pump handles up. And then exhale, contracting. And then you should feel those shoulder blades relax down at the end. Inhale up. Exhale down. And you can feel free to slow this down a little bit more to the 3 counts. So inhale, 1, 2, 3. Exhale, out, 2, 3. Let's do it just on our own with the timing. I'm going to count 1, 2, 3 in and 1, 2, 3 out. Inhale, 1, 2, 3. Stretch up. Exhale, out, 2, 3. Stretch up. Now I'm just going to do the inhale, exhale component. Count on your own. Inhale. Exhale. Inhale. Exhale. We do 10 of these. Inhale. Exhale. That's 3. 4. 5. Really get that stretch up. Bring that sternum up. 6. 7. 8. 9. You notice I bring my gaze up as I inhale. 10. That was just wonderful. So many people, when I do these together with people in my office and they come in stressed or tense, just getting over illnesses, trying to recover, they just feel so much better. So I encourage people to do those 3 times a day at least. So you can do that while you're waiting at the copy machine, while you're waiting for your emails to reboot, your computer to reload, when you're just waiting for your coffee to brew. You can do those. It takes about 45 seconds to a minute to do your 10 deep breathing with arm circles. So you have a blessed day, and I hope that this helps to improve your health overall. And hopefully we'll be coming with a part 2 with more breathing exercises.